Omega-3, a trial study for treating ADHD. Kimberly Seevers, Southwest Baptist University. Introduction. Is it possible to treat ADHD with supplements rather than stimulants, reducing the symptoms related to the diagnosis that affects behavior, cognitive, and mood, along with the side effects of amphetamines, including nervousness, restlessness, excitability, irritability, agitation, and addiction? If we could treat pediatric patients with over-the-counter supplements rather than stimulants, could this further the treatment preventing pediatric patients under the age of 18 with non-stimulant side effect medications? Why is this topic important to me? I chose this topic because I am one of many that have been diagnosed with ADHD. It wasn't until the age of 33 that this diagnosis came to light. Back when I was in high school, I struggled with reading. The reading that I did was, the issue was reading the same page 3 or 4 times and not understanding what I read. I also have 2 children out of 6 that have been diagnosed with ADHD. In treatment options, my oldest was prescribed Ritalin and Adderall for 10 years with a multitude of side effects, including weight loss, nervousness, agitation, behavioral changes during the half-life of the medication. The past few years, I have researched other options to treat my youngest daughter that has been diagnosed with ADHD because I've made the decision to not treat her with controlled substances based off what I saw when my son was growing up. Omega-3 is the new supplement that was discovered in my research, but not until this class. Why is this topic important to the public? ADHD has been a common psychiatric diagnosis in both children and adults since the early 1980s and 1990s in the United States. But the diagnosis was much less common, even known in the other parts of the world. By the end of the 20th century, this was no longer the case, and ADHD diagnosis and treatment became an increasingly widespread global phenomenon. Why is the topic important to the healthcare system? Abuse of prescribed stimulants can lead to the increased risky behaviors, legal issues, or death. The exposures and the availability of prescription stimulants can be dangerous to young adults not equipped to handle the responsibility of appropriate use. An example of this would be college students buying Adderall to stay up later, have clearer understanding, and taking it over the counter and not prescribed to them illegally. Why is it important to patients or subjects of my review? Prescribed stimulant abuse continues to rise, along with prescriptions for attention deficit hyperactivity disorders. When used with targeted symptoms, the medications are effective. However, this escalating crisis is being overshadowed by the current opioid epidemic. Peacock's statement. P for population would be the pediatric and the adults. I for intervention, using over-the-counter supplements, such as omega-3. C, the comparison intervention is the stimulations which are controlled substances, such as amphetamines. O for outcome, to reduce the side effects of stimulants. And T, time, over a 3-month period. Databases searched. The 3 databases used were ECRI, Cochrane, and PubMed. Search terms used. Treating ADHD with supplements, over-the-counter treatment for ADHD, omega-3 for treatment of ADHD. The Boolean operators used, ADHD and supplements or stimulants. Search results. The first database searched was ECRI. The search term used, treating ADHD with supplements. Results 0. Search was narrowed by keyword ADHD. Results 1. Results did not yield any interest in ADHD that pertained to the subject of the study. The next database was Cochrane. Search term used, alternate treatment used for ADHD. Results were 325. Search was narrowed by keywords, supplements, and ADHD. The results then were 26. There were 125 trials of different supplements tried and looked at, like vitamin D and fatty acids, along with how changes in diet can decrease symptoms of ADHD. The third database was PubMed. Medline was used with full text. Combined terms such as ADHD and capitalized supplements or capitalized stimulants. The results was 2,570. The search was narrowed or filtered by using peer-reviewed and dates 2015 to current. Discussions and summary of findings. Inclusions. Techniques were used to collect data were consistent. To collect the data of findings, the instrument was the ADHD Rating Scale version 4, the ALTET test, CHI-TAP behavioral test, and CPRS anxiety and depression test. The primary outcomes included safety throughout all testing. The study population included children and adolescents with hyperactivity symptoms. Part of the criteria was the subjects had to have at least 6 hyperactivity impulsivity symptoms for 6 months or more before the age of 7 and present a functional impairment in 2 or more environments, which is school or home. Exclusions. In the exclusions, there is known tolerance to omega-3 fatty acids intake or fatty acid/fish oil dietary supplement for more than 1 week during the 3 months preceding inclusions, or NPH or other ADHD drug during the month preceding, including children who required NPH treatment, were excluded in the results of the study. 2 patients in the DHA-EPA group experienced a severe adverse event where they were hospitalized for worsening ADHD symptoms. Other inconsistencies include the amount of males versus the females, and the study was only conducted in France. So with this exclusion, what I would question is what type of symptoms did these 2 individuals react with the omega-3 that sent them to the hospitals with the increased behavioral issues, etc. That part of the trial was not exposed. Gaps. Gaps included there was thought to be certain children benefit from the supplementation and that there was 2 ongoing studies at the time to see if this is true. Limitations. Transferability, and these findings were based on the findings of other populations who took the placebo pill rather than the omega-3. The 2 settings in the trial was the group of population who had the omega-3 and the ones who took the placebo. The subjects in this study were subjects aged 6 to 15 years of age who had been diagnosed with ADHD. However, 78.4% were male. With this being said, is there a correlation with ADHD in the male population, or is it just the percentage of subjects who signed up for the trial? With that said, that would make a large limitation to me, because during the age of 6 to 15, kids go through puberty. It is said that girls go through puberty quicker and they mature a lot quicker than males. So if we had the study where it was 50-50, 50% female, 50% male, would those numbers been skewed either way than where the results took place? Another limitation in the study was the fact blood levels were not taken on patients pre or post trial of any other subjects. I can tell you when my son was taking stimulants, they took his blood every 90 days. With those results, they based off whether he could go ahead and continue on with the stimulant or not. Since I've been on Adderall, I have not taken any blood draws to check any levels with in regards to this medication. This study was clearly written for the physicians and the behavior specialist in France. This trial could be useful for physicians and behavior therapists to determine if there's a better way to treat ADHD without the use of stimulants. The major findings of this study did not show any beneficial effect of omega-3 supplements in children with ADHD. With the gaps and limitations noted in this presentation, I do not feel there is enough evidence to support the study or change. With the ongoing studies about the diagnosis of ADHD and the stimulants, I do believe there will be a study to come that will better suit giving children stimulant medication. As for my own studies, I will continue to research other possibilities such as diet and exercise, as well as the benefits of CBD oil before I give my daughter stimulants.